Hello and welcome. We are water professionals and our job is to improve water quality. Imagine having better, more accurate data at your fingertips to make decisions more quickly and accurately when you needed to. Water professionals across the world serve an essential role in all of our quality of life, and they provide a service that goes beyond just treating wastewater. And truthfully, what most of us know about wastewater systems is probably what we learned on Mike Rowe's Dirty Jobs, and that's enough of an inside peek for most of us. Anyway, today we're excited to share with you how wastewater-based epidemiology and the use of innovative data is transforming the way industry leaders serve our communities. Consider the impacts of COVID-19, a topic so fresh and concerning to many. The world was forever changed December 2019 when COVID-19 was first detected, and then began to spread worldwide with double the number of cases every 3 days just by the end of March 2020. Historically, the spread and tracking of diseases like COVID has really taken a wait-and-see approach, meaning we had to wait for those infected to actually report symptoms or worse, be hospitalized with an illness to better understand that there was a presence of a disease within a community. And unfortunately, this really prevents agencies from preparing for widespread hospitalization situations, need for medical care and additional medical supplies, such as we saw during the COVID outbreak last year.
Wastewater-based epidemiology involves the testing of wastewater to evaluate the presence of pathogens within a community or wastewater source. While it's been used by academia for research purposes for decades, its use as a means for disease surveillance is receiving increasing attention following the COVID-19 pandemic, as a means to identify trends in infections within a community and provide earlier warnings of the presence of a virus. We've got 3 case studies, all slightly different as they should be, to provide a diverse and thoughtful perspective on this. So let's start with Brazil, a developing nation with high social inequality, dense urban populations, and poor infrastructure. Approximately 35 million Brazilians do not have access to treated water, and 100 million do not have access to sewage collection. We've seen early successful monitoring in the Netherlands, Australia, France, and the US, but for developing nations such as Brazil, the surveillance strategy requires a different approach. Typically, monitoring can happen at the influent of sewage treatment plants. But in Brazil, where sewage systems do not reach much of the population, testing only at treatment plants would give us very little data. In this case, you'd have to monitor at different points in the sewage network. There's a really exciting initiative being led by the Brazilian National Water Agency and the National Institute of Science and Technology, in coordination with several other partners, including the sanitation company from Minas Gerais and the Minas Gerais Department of Health. This project will monitor the city of Belo Horizonte, located in the southeast of Brazil, with a population of 2 million people. They'll be monitoring based on regions and hotspots, and hotspots are exactly what you think they are, areas where there's hot and lots of activity. This will require deeper and creative deployment and coordination. The pilot will eventually expand the collection of analysis of samples to hotspots such as airports, bus stations, schools, and vulnerable communities to give leaders an idea of the community health in places not served by sewage collection, and most importantly, help leaders identify urgent and regional actions. Monitoring sewage may have seemed like an unlikely resource in the SARS detection, but it's actually been studied for decades. As we said earlier, this is essentially disease surveillance, and you can try to capture potential outbreaks. In Israel in the 1970s, the infectious polio virus was detected in sewage 9 days before doctors had identified the first case. And prior in the 1960s, researchers at Yale University conducted several experiments using wastewater surveillance to assess the efficacy of polio vaccination campaigns, which are very relevant today. Which communities have had the vaccine, which haven't, and why on a deeper level? What are the societal, behavioral, and economic reasons for this? So looking toward the future, the multi-departmental, multi-agency, public-private sector collaborations are extremely important. One of our very own WEF members, the Metropolitan Water Reclamation District of Greater Chicago, which I'm proud to represent, is participating on a nationwide sewage surveillance project approved by the United States Department of Health and Human Services. The MWRD will test wastewater from plants that serve 10% of the population. Agencies such as the MWRD understand the critical role they play in the stewardship to public health. Helping public health agencies give an edge with this kind of data will help implement equitable strategies, not only for our local communities, but all over the world.
We all know hindsight is 20/20, but is that really how we want to determine our future, our fate? No, it is not. You just heard 3 case studies showing an innovative approach that combined historical knowledge, how they address past pandemic issues, along with new data right from the sewer system using wastewater sampling and testing right from manholes. This is the approach that's guiding our current water professionals to make more informed decisions that will allow them to respond proactively relative to the COVID outbreak. This is a perfect example of leveraging data to improve outcomes in an emerging crisis like COVID. But we can use the same approach to environmental challenges that any one of us may face. So what I want to close with is to tell you that the usefulness of these data sources is really going to vary depending on the role each one of us play. And it's important that water professionals utilize a diverse range of data as well as experts that are evaluating this data before making those very important decisions that impact our quality of life. In terms of wastewater-based epidemiology, some of the data sources that you heard were relative to social impacts, meaning which communities were hit the hardest and why. Economic impacts, what financial burden resulted from the pandemic in those hardest hit areas. Those are being taken into consideration. But there are also other factors we need to consider as well, like political and environmental. In our next video, we're going to highlight another unique case study that harnessed data across a wide range of sources to improve the decision-making process and ultimately improve water quality throughout a community. We'll see you then.